So now we have been trying to understand that the modes of homeopathic medicines, how it is going to be dispensed, and how, in what containers we are going to put it. And as of the discussion went on, the glass vials are more safer and purer, and they carry the complete quality of the medicine. So this is the my understanding of the discussion on this particular question. Now there are another few ways and methods where these homeopathic medicines have been dispensed. Some of you must have been known that the blister pack has come nowadays, where the homeopathic medicines have been dispensed. Now whether this blister pack is good enough to carry these homeopathic medicines to the patients, I would like to say a little about this blister pack. See, blister pack is something where you have there are holes in it. You put the globules or the discate in it, and there is a foil which covers it, and under the heat you press it. Now I would like to ask Dr. Ramdas where the purity gets disturbed once the heat is used.
Personally, I have not used any blister packing. I am not used to that. I am still probably little conservative. But initially, when this blister packing concept came, I thought we are trying to play a psychological role again with the patients, that this appears more like an allopathic and patients are comfortable. That was my initial impression. But however, that may not be purely all that. So it has its advantage and disadvantages. Advantages are that if you prepare this blister packing of so many medications, it is easier to dispense and easy to carry. So that way the patient can pop out the blister area and take out the tablet and pop it into his mouth. So that way it is convenient. But the disadvantage is how many medicines, how many thousands of medicine you are going to prepare the blister packing and then dispense. Whether that is practical, I am not sure. But as far as the heating element is concerned, whether that will have an impact on the medication is something. If we are talking of anything, see, we are telling that don't expose the medicine to perfume bottle, don't expose the medicine to heat, don't. So whether that has an impact on that, people who have used it must tell me. But if that is the element that is going to block it, we must, as much as possible, avoid it.
Avoid it, okay.
That's it. That's from the really scientific point of view I am putting it across.
Okay.
But practically, it may appear pretty good.
Okay. So, that means, as we are all aware about the other industry, the packing methods which is being used in the other industries, now for example, the allopathic industry or any other cosmetic industry, now adopting that measure in dispensing homeopathic medicines, what could be your idea, Dr. Veera Brahmachari?
Sorry?
Whether we would like to adopt the other industries where they are dispensing the medicines, they are also dispensing in blister packs, in strips and glass containers also, you know, but they have a definite method of dispensing their medicines which goes to the consumers, that is the patient. Now, as the homeopathic fraternity looks at, how do you feel that the other industry who are using this dispensing method can be used by this homeopathic system?
No, as per my knowledge, we cannot use other industries what they are using, because our system of medicine is entirely different. How vital is our system? How we dispense, that is also very vital. So the quality of the medicine should not spoil, or should not destroy, or should not nullify. If we go for other industries like how they dispense medicines, modernize, as per my opinion, it is not correct. We have to dispense the medicines. If we give quality to the patients, means we have to dispense medicines according to our whatever our mode of dispensing is there. According to that own homeopathy only, we have to dispense the medicines, as per my view.
Okay.
One of my experience, which I had much earlier when I started my practice, there are practitioners, I don't want to name anybody, who were packing, they used to buy this empty capsule, gelatin
Exactly,
capsules,
exactly. I was coming to that.
gelatin capsule, and fill the medicine with this.
Five size globules.
Yes, 5 size globules or even powders,
Exactly.
and then ask the patient to take it. It's, I think, purely cheating. I don't think it's necessary because our medicines are best absorbed sublingually when we say it doesn't have to really go into the stomach. See, allopathic drugs have certain character only where they have to dissolve in the stomach, and the capsules are given. Injections are given because the drug can get mixed up with the blood faster. So there are different things, but not for homeopathy. I don't think that's a cheap way.
The main thing is,
Yeah, Dr. Dinesh.
see, the discrete, I mean, the demarcating point is, ours are dynamized systems and dynamic medicines we are dispensing. They are dispensing inert substance. It makes no difference whether they dispense it through X, Y, Z data, whatever it is. We say don't keep it near the perfumes. We say don't keep it through near the high level, vaporizing conditions. We say a lot of things. Why? Because they are dynamic in nature. The dynamicity and the quality of the medicine can disturb. So when we are describing or dispensing, that we must be aware that we are dispensing the dynamic medicines. We are not dispensing the inert substance. These two basic things, and go to Fountainhead, dispense it as far as possible as what Hahnemann has told, slight modifications to the present day world.
Right. Thank you, Dr. Dinesh. So we have to come to a kind of a conclusion with today's discussion that the homeopathic medicines are being dispensed in different modes, and the best method of dispensing and the best method to carry these homeopathic medicines to the patients is the glass vials. That is what Dr. Ramdas and Dr. Rudresh also said. But depending on the needs of the patient, depending on the psychology of the patients, and depending whether they are urban or rural, Dr. Rudresh opined that the method dispensed through diskettes would be more ideal, and the patients also would be easier for them to take it, and even the dosage is also easy for them to say. Even at the government sector also, Dr. Manjunath was telling that it is easy to be dispensed through the globules, and Dr. Veera Brahmachari also said that he's been also dispensing through homeopathic medicines through the globules. So I think the audience also, you also agree that the homeopathic medicines can be dispensed more easily on globules and diskettes, rather than the liquid form. But some of the states, as Dr. Brahmachari said that during his visit to West Bengal or Bihar, he said that they do prescribe dispense medicines in the liquid form, in the distilled water. So once again the question of distilled water comes, whether it is pure or impure. So many factors they come. So I think I thank the panelists for having such a wonderful discussion on this aspect, and I thank all the audience also